please give us an overview, if you could, of what Oakwood's Total Joint Replacement Program offers to its patients.
We have a unique opportunity, and I think one of the things that's very important is all four of the Oakwood Healthcare System hospitals have the gold seal of approval from the Joint Commission. And what that really does is set us apart from really any other hospital system in the area, in that each one of the hospitals has an appropriate length of stay, appropriate therapy programs, appropriate treatment programs, decreased infection rates, decreased rate of blood clots, and excellent therapy that goes along with it. So all those added together give us a real strong position with respect to the Oakwood Healthcare System.
And the Oakwood's orthopedic services are uniquely effective because of that?
Yes, absolutely. The other thing we have, which just occurred within the last year, is we also have a very strong affiliation with Wayne State University. We have a orthopedic residency program that is now based out of the Heritage Hospital System, with some rotations through Oakwood, Maine, and Dearborn. And we also have a physical medicine and rehabilitation residency program that's affiliated with Wayne State University that takes care of the patients in the rehab unit at the Heritage Hospital, as well as seeing consultations at the other institutions. So we have a very strong presence academically as well as with the physicians, and that puts us in a unique circumstance.
And I'm sure there are listeners who say, I might become a prospective patient of the orthopedic services at Oakwood. What would you tell them?
Well, I think we have, at least at Oakwood, I think every single service available. What I mean by that is orthopedics has been divided into subspecialties. We have specialists in the area of sports. We have specialists in the area of spine. We have specialists in the area of hand. We have specialists in the area of total joint replacement. We have specialists in the area of sports medicine. And we also have very, very good general orthopedic surgeons who practice there as well. So we can represent the specialties within the field of orthopedics very well in the Oakwood Healthcare System.
Yeah, hi, good morning. Great show.
Thank you.
My question is, I just recently got a attack of gout, and I normally get, in the last few years, one a year, and then, I'll go to my doctor or podiatrist, and I'll get a cortisone shot, and the next day later, or maybe 2 days at the most, the pain subsides, and, I basically go back to normal life. But this last attack I've had for over 3 weeks, and I've tried, the medication that was prescribed, colchicine, and did the ice packs and all this stuff. And this one seems to have, it lingers on. It's been over 3 weeks now, and I want to know, if there's other treatments or, what else can be done.
Dr. Sorcy?
Yes, good morning, Ron. It seems like, do you always get this attack of gout around the holiday season? Do we lose Ron?
Ron, are you there?
Oh, yeah, I can barely hear you through the phone.
Ask your question again, Dr. Sorcy.
Yes, Ron. Do you always? You said you get this attack once or twice a year. Is it always around the holiday season?
No, it is. It's no set time. This last one was the week before Christmas, but there was no. It's just once a year.
Well, by and large, Ron, gout is first and foremost a medical condition treated by a medical physician, primary care physician, such as your family practice physician or internal medicine doctor, and it definitely is related to the amount of urate that you consume. So diet and wine, red wine or meats would affect this. That's why I asked if it was around the holiday season, which we all tend to consume more of those than usual. So first and foremost, it would be dietary, and then treatment would be medical. The time you would see an orthopedic surgeon is if you've had gout long enough to the point where these conservative measures fail. And at that point, you could develop a gouty arthritis. And what happens in the great toe, you get deformities, significant pain, warmth, redness. And there are surgeries for this in the great toe, anything from quote-unquote cleaning up the joint or chelectomy, where you remove the osteophytes bumps around the joint, and what's called the gouty tophi, which are these crystalline urate crystals that we clean up. If, however, the articular cartilage is so destroyed, the recommended treatment would be joint fusion. We actually fuse that joint, and when we get to that point, the patient actually is trading a painful joint that doesn't move for a joint that doesn't move but doesn't have pain. And it's a very accepted procedure, more so than a joint replacement. The replacements in the toes are not very good. They don't last very long, and they don't have the longevity of the hip, knee, or even shoulder replacements that we have today.
Ron, go ahead.
I'm sorry. So first, Ron, I would recommend get a hold of your primary care physician and get on a routine medical regimen attacking the cause of the gout first. And then when the consequences are so severe, then perhaps go see an orthopedic surgeon.
Ron, thank you for your call. We're going to go and get one more call before we get out of here. Linda has been waiting in Flint. Linda, what's your question this morning?
Good morning. I am 49 years old, and in the past 7 years I've had cervical neck surgery, my big toe surgery, carpal tunnel surgery, and now I'm having some knee issues with a couple weeks ago my knee felt like something inside tore, and now going upstairs is extremely painful. I know I have an issue with the knee, but I'm wondering if these could all be related, and what kind of doctor I should be seeing.
Linda, thank you for your call.
Good morning, Linda. Can I ask you a question? Do you have you had a fall to the knee? I mean, have you twisted the knee, injured the knee recently?
I think I stepped wrong and it kind of tweaked it, and it felt like there was a tear or something inside. But I mean, normally just walk around, it's not bad. It has a little clicky noise, but walking up and down stairs is extremely painful, and I have to ice it if I do too much walking up and down stairs.
So it does swell also. Does the knee swell up?
Not real bad, just a little bit on the side.
I think the answer to your first question, are these related? It doesn't look like it's related. Usually the relation, if it's what we call an inflammatory arthritis, where like the group of rheumatoid, where the joints inflame and get swollen, hot, tender, and that's usually affect multiple joints. But what it looks like, it's this, the knee problem is more of a traumatic type, which happens, and most likely you might have torn a cartilage inside the knee. So what I would suggest, as the symptoms is bothering you, is see your primary care physician or the internal medicine to assess your knee, and then either to refer to an orthopedic for further evaluation and whether surgery will be needed or not accordingly.
Well, I'd like to thank all of you for coming in this morning and sharing your time and expertise with our listeners. I really appreciate your time. Dr. Lawrence Morawa, Dr. Angelo Sorci, Dr. Abdullah Omari. Thank you so much.